Hi, I'm Dr. David Dow. Here we are in our examination room today. What I want to go over with you is why you should see a chiropractor before seeing a surgeon. Now, first off, if you're at a point where things have gotten so bad already that you need to see a surgeon, that's possible. You might be at that situation, that point already where things have gotten so bad that there's nothing we can do to help you. That being said, there's a good chance that we can help you, that you may not have gotten that bad so far. So the types of injuries we look at that would end up often sending you to a surgeon if you wait too long is an injury called a subluxation. So a subluxation is when you get a bone in your back. Usually it's going to be a neck surgery or low back surgery. So a neck or low back injury. Maybe there was a car accident or a fall or a sports injury, and that bone shifted out of place and it started putting pressure on the nerves and started causing those symptoms. Now, some of those symptoms, when things get really bad, it might be numbness or tingling going down the arm. It might be sciatica, numbness, tingling going down the leg, maybe all the way down to the foot when things get really bad. Also, if you're not at that point yet where you're starting to get some pain and it's not going down to the arm or leg, there's really a good chance that we're going to be able to help you. If it is already going down into the arm or the leg, there's still a really good chance that we'll be able to help you. But what so many people do is they'll take medications that sometimes work so well that they never address the cause of the problem. They never get that bone back into place, never get the pressure off the nerve. Because the pressure's still on the nerve, the symptoms just keep going, they keep getting worse and worse. So then what happens is over time, things will start to degenerate. And the first thing that will happen is usually you'll start to see the person's posture getting worse, and they'll lose the curve in their spine, and that's visible on the x-ray. A lot of times the medical doctors will look at that. Oh, we don't see a disc problem. We did an MRI. There's no problem. I'll look at the x-ray and I'll be like, you've lost that curve in there, and that puts pressure on the nerves. So that's also correctable. And you want to stay tuned for some of our videos that show you how to correct the curve in the neck. Then if it gets worse, we'll start to see thinning of the disc and the bone spurs. Now at that point, that's what arthritis looks on the x-ray. That doesn't mean that you're needing to do surgery. There's still things in there that are going to be very, very correctable. Some of it might not be totally correctable, but the pain is probably correctable. And restoring the function of the joint, there's a great possibility that we can do that. Now, if it doesn't get corrected at that point, it can go down to the point where it's basically bone on bone. There's big bone spurs in there. That we may be able to help with as well. And so when it starts to get worse like that, chiropractic may help, maybe not. I'm also an acupuncturist. We often find that acupuncture can help, and we can help people to avoid surgery even at that point. After phase 3 degeneration, we call that, I would say we go into phase 4, which is going to be the surgery and then the medications. Just so you know, once it hits that point, most of the time we can't help you. I always have to keep you up in this area where we can make a difference and where we can get things corrected. So hopefully that makes things clearer for you. A lot of times the medical doctors are only looking at the disc. Actually, the Mayo Clinic did a research study, 3,200 cases, the MRIs that they did, and they did it on people that had pain and didn't have pain, and they found that the vast majority of herniated discs were in patients that didn't have any pain at all. So they found that the disc is not where the pain comes from. The pain actually comes from the loss of function in the joint. And we can see that by doing an x-ray, but actually we have to do a special type of x-ray called a motion study x-ray, where if it's in the neck, we have you bend forward and bend back so we can see how the bones are moving, which bones are moving, which ones are stuck. Or in the low back, we'll have you bend to the left, bend to the right, and then we can see how those bones are moving and exactly what we have to do to get it corrected. If you haven't had those motion study x-rays, that's what I recommend that you get done. And we'll do a talk coming up here about motion study x-rays and how important they are. But that's why you should always go to the chiropractor before seeing a surgeon. And not only that, we want to get the pressure off the nerves, but we want to keep the pressure off the nerves. And stay tuned for more videos that show you how to keep the pressure off the nerves. All right, thank you.